Good afternoon. My name is Lisa Rathke, and I'm the Student Health Promotions Manager here at UW-Stout. I'm excited to give you some information about health while you are traveling abroad. Probably the most important thing that we're going to talk about today is about getting a pre-travel physical prior to your traveling. And it doesn't matter if you are traveling for a short term or a semester long program. We do recommend that you see a provider 4 to 8 weeks before travel. The reason for this is that during that physical time, you can talk with your provider about a variety of things that we're going to discuss in more detail here through this presentation. There is no charge for getting your pre-travel physical at Student Health Services here at Stout. So the first thing that you might talk to a provider about is vaccines. There are some very routine vaccines, including COVID vaccine that is recommended, tetanus vaccine every 10 years, measles, hepatitis B, varicella, which are very standard childhood vaccines, which you likely have already had, and then seasonal influenza vaccine. And remember, when you are considering seasonal, if you are traveling to the Southern Hemisphere, their flu season is in the summer, not in the winter. So that is something that you may want to really check when your last dose of influenza vaccine. Some other very specific travel vaccines include hepatitis A vaccine. That's a 2-shot series. One typically is done initially before your travel, if you're doing it at a pre-travel physical, and then 6 months later to receive the full effect of that 2-dose series. Typhoid vaccine, if you are traveling to many of the island nations, many South American nations, many of our Asian nations, African nations, typhoid vaccine is recommended. This is an oral prescription, and you would want to be taking that prior to your travel. The other vaccines here listed are less frequent, but they may be things that are considered necessary for the countries that you're going to travel. And they're listed here. So things like the meningitis B vaccine, rabies vaccine, yellow fever vaccine, Japanese encephalitis. And some of those vaccines are those that you have to get at a travel clinic. The clinic here in Menominee at Mayo does have some of these vaccines. There is a great travel clinic associated with the airport in Minneapolis, St. Paul, and they have those vaccines. So some of them, it all depends based on where you're going to be traveling and what kind of experience you're going to have while you're there, if those vaccines might be indicated. If you don't choose to have a pre-travel physical, you still can look up and see which vaccines are recommended for the country that you're going to travel to. CDC.gov has a great travel site, and you can put in the country that you're going to be traveling to and then look up what vaccines are recommended for the activities that you're going to be doing in a specific country. Also on this website are alerts about things that might be happening very specifically in a country. So you can look for any sort of travel alerts on that site. So in addition to visiting your physician, you may want to consider looking at that site, because it just gives you kind of the up-to-the-minute update about what is happening with various diseases or outbreaks that could be happening in the country that you're going to be traveling to. Another thing that you may want to discuss, depending on where you're traveling, and again, is malaria. And we're talking specifically again about some of our South American countries, island countries, some of our Asian, African countries. So malaria is a disease that is transmitted from an infected mosquito. If you are traveling to a country that has a malaria warning, and again, you could find that at the CDC site, or your provider may indicate that to you, just being aware of having um, avoiding bug bites, mosquito bites while you're there. You know, it may be that you're having um, bug repellent with you. You may be using netting when you're sleeping, you know, so just being aware of what the recommendations are in your area. There is a medication that you can take before you travel, and you take it through the entire time you're traveling and for a short period of time when you come back. And so that's something that you would talk to your physician about if you're going to a country that is at risk for malaria. If you are in one of those countries, you may want to, you know, when you return, if for some reason you would develop a fever, think about malaria after travel. Another thing that you would discuss with your physician would be about traveler's diarrhea. It is something, it's a very real thing that does happen. And so you're going to want to think about your food choices when you're traveling it. You know, are you using bottled water? That is typically very much recommended. If you don't have access to bottled water, you know, certainly boiling it, in eating things that are well cooked, eating things that have a rind that you can peel so that that inner part, you know, is you know that it has been protected. Or if it's something that you're not sure how it was prepared, or you're not sure of the water supply that it was washed in, forget it. There is both over-the-counter medications and prescription antibiotics that can be given prior to travel so that you can deal with traveler's diarrhea should it develop. We did mention earlier about COVID vaccine, very important for travel. Uh, as far as COVID testing, right now, as of today, which is June of 2022, most countries, including the US, do not require COVID testing for entry. We do encourage students to travel with a COVID antigen home test because COVID testing can be a little bit difficult to find in some countries. And if you are having symptoms and you are with a group, or if you're traveling, you know, alone, it is still very nice to know if you are having any sort of COVID symptoms, if it is another illness, or if it is actually COVID. And so having that resource with you when you travel is really recommended. And the CDC website has lots of great resources. Should you test positive while you're traveling, you could look on the CDC website and they will give you guidance about how long to isolate and quarantine, or not quarantine, but isolate. Another thing to talk about is sexual health. And we really encourage students to be prepared for any sexual health needs they may have while they're traveling. Important to have a birth control plan. If you are going to be gone for a semester, you want to think about, you know, what sort of birth control do you use and how available will it be to you? There's certainly longer acting birth control options, things like IUDs or Nexplanons. Many times people will choose to have those placed prior to travel so they aren't having to think about it. If you do take birth control pills, you certainly can consider getting an extended supply of them prior to travel. Some people will, you know, get 3 months from their insurance and then purchase an additional amount to have on hand so that they don't have to establish care in another country. Also important to think about sexually transmitted disease prevention. Having access to condoms with you when you're traveling, if you're planning to be sexually active, is a really good idea. Want to just mention a couple of words about consent. This is something that is really good to think about ahead of time. Consent in other countries can be different. Sometimes in other cultures, accepting drinks or dinner can be seen as consent. Uh, you know, and that is different than in the United States. We really encourage that that you need to have verbal mutual consent for sexual activity. Absence of that does not imply consent. And so certainly think about that. Past consent does not imply consent in the future. So you should be aware of that. And then just being aware that consent should not be gained by force, intimidation, coercion, or by taking advantage of someone. Just a reminder about Title IX prohibited behavior. So sexual misconduct includes dating violence, domestic violence, non-sexual, sexual content, sexual exploitation, sexual harassment, and stalking. So if this is something that you experience while you're traveling, you can reach out to the university or the program in country where you're traveling. You can reach out to the Dean of Students office, and you can reach out to them via the Dean of Students webpage, or you can call there, and that is the Dean of Students at Stout, and they will assist you. And the Bridge to Hope, which is a domestic violence shelter here in Menominee, also can provide resources for UW-Stout students who are traveling or when they return. So just to be aware of what resources are available to you.